Hello, welcome to this edition of the news on Équinoxe Television, live from our headquarters in Cameroon's economic capital, Douala. I am Babla Jonathan. In our top stories in this edition of the news, as the number of confirmed cases of the COVID-19 continue rising in Cameroon, Africa, and the world, the president of the Cameroon Academy of Sciences, Professor Sami Beban Chumbo, says the situation is critical and stringent measures must be taken to stop the spread of the coronavirus across the country and of course across the African continent and the world. He was speaking to the press today in the nation's political capital, Yaoundé, and travelers decried the attitude of drivers in the northwest region of the country who continue to overload despite the measures taken by government to prevent the spread of the COVID-19. Cameroon's Minister of Public Health, Dr. Manauda Malachi, has urged Cameroonians to stop stigmatizing persons who have tested positive for the COVID-19. The minister was speaking during a press conference yesterday in the nation's political capital, Yaoundé, and he gave updates on the situation of Cameroon as far as the coronavirus pandemic is concerned. And as of now, at least 193 persons have been tested positive for the coronavirus. However, there are some that are still suspected cases yet to be confirmed. Details with Manjik and Gabriel.
As of the time of this report, Cameroon was counting 193 cases of infected persons with the COVID-19 virus, according to this tweet from the Minister of Public Health, Dr. Manauda Malachi. In his routine press briefing to update Cameroonians about the disease on Monday night, Public Health Boss says in the days ahead, a solidarity fund will be opened to support victims of COVID-19. And also a concentration site will be made available at the Olembe low-cost housing area.
That head of state has been kind enough to authorize the creation of a solidarity fund which will be implemented shortly. The government has undertaken strong actions with a view to providing our main cities with large capacity center to accommodate COVID patients. The accommodation of Olembe is already and will be able to receive 200 patients by the end of the week.
It was an opportunity for Dr. Manauda Malachi to once again reiterate the fact that the respect of the 13 measures put up by the government is vital.
I call on the collaboration of population and the mobilization of all local authorities to facilitate this operation. This approach will be extended to other regions depending on the evolution of the situation. Let us remember that each of us can and must contribute to block the way to COVID-19, or at least prevent its spread. In order to do so, we must strictly adhere to the barrier measures enacted by the government.
It was an occasion for the public health minister to warn against self-medication.
Self-medication based on manufactured products or traditional pharmacopoeia is a dangerous practice that should be avoided.
A team of doctors are expected in Cameroon's economic capital in the days ahead, according to the public health boss.
From 2 to 6 April 2020 in Douala, we are going to launch an intensive door-to-door testing campaign with the aim of limiting the spread of the epidemic as quickly as possible in our country, particularly in cities where we observe a fairly high probability of community contaminations.
The government continues to tell Cameroonians to be responsible, disciplined, and if possible, stay at home all day as a way to fight against the deadly virus.
Cameroon's Minister of Public Health, Dr. Manauda Malachi, speaking there during a press briefing in the nation's political capital, Yaoundé, yesterday, and it's a daily briefing on the situation of Cameroon. According to the professor, the president of the Cameroon Academy of Sciences, Professor Sami Beban Chumbo, the situation is critical and urgent, and stringent actions have to be taken to prevent the worst from happening in Cameroon and the rest of the African continent. He made a statement on behalf of the organization today in Yaoundé. Take a listen.
Considering that there were only 228 cases in Africa 3 weeks ago, the situation is alarming. Cameroon recorded its first imported case on the 6th of March, and the numbers have been steadily rising to about 193 as of today. So these cases render the situation very critical. So the evolution of COVID-19 is a dynamic one with an exponential rate of spread. There is therefore an urgent need to combat this epidemic with stringent measures for the prevention of new cases, especially through local transmission, and thus hopefully maintain low fatality. The Cameroon Academy of Sciences, through this statement, acknowledges and endorses the World Health Organization strategy for containment, particularly basic preventive measures by individuals and communities. The Academy salutes and supports government COVID-19 national response strategy, which is very strongly established on the World Health Organization's strategy for containment of the pandemic. The Academy acknowledges the sacrifices being made by health personnel under difficult working circumstances, recognizes that the ability of our healthcare system to adequately respond to a surge in severe COVID-19 cases can be easily stretched to a breaking point, and therefore recommends stringent healthcare personnel protective measures, especially availability and use of optimal personal protective equipment. The Academy calls on all persons to fully respect and implement the science-based World Health Organization and Cameroon government's directives for controlling the epidemic, especially personal and communal directives on hygiene and social distancing.
Was Professor Sami Beban Chumbo, president of the Cameroon Academy of Sciences, speaking there and calling on all Cameroonians to respect the government and WHO measures against the coronavirus. The measures are not being respected by many Cameroonians. In the northwest region of the country, travelers have been decrying the attitude of drivers who are violating the rules of government, and more precisely the Minister of Transport, with regards to the COVID-19. Overloading is still the order of the day in many parts of the region, and some of the travelers were speaking to our correspondents Stella during a visit of the Northwest Governor Adolphe Lafrique to some travel agencies and markets to measure the level of implementation of the government measures and the sanitation or hygiene rules of the World Health Organization to stop the spread of coronavirus. Her report.
As at 7 a.m. March 31st, 2020, Cameroon had recorded 119 COVID-19 cases, 6 deaths and 5 recoveries, reason why regional administrative authorities are leaving no stone unturned.
The screening exercise is mandatory for everybody, including the drivers, the passengers, the civil servants, the security men and women. And it is very useful, even if it is not the lab exam, it is starting point that can inform the medical team of the temperature of the passenger, of the man who is screened, and from that start investigate to know if he is already touched by the virus.
Governor Adolphe Lafrique drives in from Yaoundé, where he had been attending a meeting. He is tested at Matazem like everyone else entering the Northwest region. Bamenda might not have recorded any COVID-19 cases so far, but everyone is aware and observing some measures.
When I go cold store for buy my fish, we use sanitizer.
We for food market, we will don't start since the day when they announce and say, no, all man must wash his hand, all man must get this mask, and all man must sanitize his hand because they sick, you know, fine. Because you look man for face, you don't know one way. You get the sick. So all we must prevent them. From the beginning, I start biting the share for all man. Up to today, we should continue. Like for year, all man must wash his hand. We no one die, and with the praise say God, we heavy with this sick, we move out from his skin with the back.
No, this thing they so the only prevention, because prevention be better than cure.
But at the markets, travel agencies and streets of Bamenda visited this morning by the regional governor and team, social distancing has remained a great issue. No one seems to care. Some display are just for the cameras.
Sister. They are carrying passenger on the way. Yes.
The Northwest region is yet to recover from the Anglophone crisis, and every hand is needed on deck to bar the way for COVID-19 from spreading to the Northwest region.
We are therefore appealing to the population of this region to make sure they implement those measures. They better stay at home. They shouldn't travel because it is risky to travel this time around. The school has already been closed. The parents shouldn't, instead of taking care of their children at home, send them to the market where they are at risk. And if there is a suspicious case around us, they should better inform the medical team.
In Bamenda these days, buckets of water like this one at the Bamenda main market entrance have been provided with messages encouraging everyone to wash their hands.
Bustela reporting from Bamenda in Limbe in the southwest region of Cameroon. The city mayor, his collaborators and health officials are moving through the town, sensitizing the people and encouraging them to respect all the government and World Health Organization anti-COVID-19 measures. Our correspondent Davison Maimo reports.
Gathering of more than 50 persons prohibited. Social distance of at least 1 meter to be respected. The decision, critics say, is not enough, given that off-licenses are now crowded during the day. Business places in general are operating, and most of all, markets are functional. This is what pushed the Limbe City Mayor, Andrew Motanga Monjimba, in collaboration with the Limbe Health District, to go down to the field, meeting with the population in the market, motor parks, and other busy areas within the city, to preach the gospel of prevention is better than cure.
Coronavirus is real. No be na propaganda, no be na politics. Coronavirus is a kill. I come to say, but we understand, or we say this disease is real, but we please avoid them for our town.
The sensitization campaign, according to the city mayor, is to amplify safety measures against the COVID-19 virus as prescribed by the Ministry of Public Health and the World Health Organization.
If we do avoid these little things and practice the hygiene, simple hygiene, we may be able to avoid this disease.
To the district medical officer of the Limbe Health District, Dr. Constant Guninje, the sensitization campaign is timely, given that the city of Limbe is a tourist city with new faces entering the city almost on daily basis.
Any bush fall away there for your house, it gets more fever, cough, catarrh,
carry him go for the nearest health facility, or you go straight from one hospital.
I find it. Number one for protect myself. You know, when I reach any man where I see it today, I will tell you where they don't can tell with market.
And as a day, first, protect ourselves before the sick one enter.
Using hand sanitizer and washing of hands with soap and running water. Avoid crowded areas. Stay indoors if possible. Remain the watchword against coronavirus.
In Buea, chief town of the southwest region, some young people have engaged in the COVID-19 sensitization campaign, and they are going through different parts of the town, encouraging Cameroonians in the town of Buea and all other persons in Buea to respect all the sanitation rules of the World Health Organization and the measures taken by the Cameroon government so that COVID-19 will be stopped from spreading across the country. And Derek Jato followed some of them and compiled this report.
With one case of coronavirus now confirmed in the southwest region, these Anglophones on many say need to engage an aggressive defensive measure to stop the virus which is already in the region from spreading. Here at the Munya market in Buea, where social distancing is absent, one organization by name Community Empowering Movement for a Responsive Society, SEMRES, is accompanying the government in the fight against coronavirus. And SEMRES has taken up one preventive measure, that of regular washing of hands into the market.
Some people were coming and they were asking if they pay before washing their hands, but we made them to understand that it's free. We just came to sensitize them on coronavirus and to make them to know they need to wash their hands each and every time to prevent coronavirus.
This time, not waiting for people to come and wash their hands. Instead, this team of SEMRES volunteers are moving with water, soap and hand sanitizers to meet people where they are. It is a unanimous fight and everyone must contribute his or her own quarter.
We are here to sensitize our own population to make sure that we prevent this spread of this COVID-19, to make sure that we help stop it. I mean, if we are here to do this like what you are seeing here, we are making sure that the virus does not exist. Like in the process, what we are doing here, people wash their hands and we give them hand sanitizers to make sure that everything moves on smoothly. I mean, even when they go back to the houses, we even give them flyers to make sure that they help educate their children.
The practical awareness campaign was highly appreciated by all.
I'm really thanking them, and God should bless them for their good work and give them more power.
I'm happy for the exercise.
We thank God how we will bring them. Say, we wash your hand, make that thing no way. If you go back for house, maybe I will them and clean them.
I will talk to my friends how it be good.
Described as an eye-opener, those who participated and washed their hands promise that they will continue the exercise in their neighborhood and to tell others to do same, for coronavirus is real and it is killing people.
And scientists say men are more likely to die of COVID-19 than women, and studies show that old people and people with underlying medical or health factors are more at risk, with higher mortality rate than other social groups. For me, Armstrong Sander with the details.
The virus spreads across the world. The fear to lose one's life is increasing, and people want to know who is most at risk from the coronavirus. Health officials since the outbreak have repeatedly assured the public that the risk of dying is low unless one is older or has an underlying condition. In effect, data from China, the United Kingdom and the United States shows that death rate is startlingly higher than average among persons aged 60 and above, as well as people with high blood pressure, diabetes, asthma and other chronic conditions. The Wall Street Journal on March 14, 2020 cited a large study from the Chinese Center for Disease Control and Prevention, establishing that 14.8% of people aged 80 and above died of COVID-19 and 8% of those 70 to 79 died of the disease. For people with cardiovascular disease, mortality rate stands at 10.5% and 7.5% for those with diabetes. Those rates compare to a 2.3% mortality rate in the overall population, an experience which has consistently proven the same out of China, in Europe and America. Other underlying factors to the coronavirus includes a respiratory disease, hypertension, and cancer. On the sociological factors, the Center for Disease Control says men are likely to die of COVID-19 than women, and in the United Kingdom, health officials recently classified pregnant women among the more vulnerable social groups to COVID-19.
That was for me, Armstrong Sander, reporting there. And now we're going to talk about the President of the Republic of Cameroon, Paul Biya, who has created a solidarity fund for the fight against COVID-19 in the Republic of Cameroon, and that information has been made public by the country's Prime Minister and Head of Government, Chief Dr. Joseph John Gute. That fund has been credited with 1 billion francs CFA as of now, a solidarity fund created for the fight against COVID-19 in Cameroon. This is one of the issues raised by the national president of the Popular Action Party in a press statement in which she was calling on Cameroonians to create a solidarity fund for the fight against the COVID-19. And the president of the Popular Action Party has expressed concerns over what he qualifies as inaction of the president of the Republic of Cameroon. In a press statement, Jean Denis said President Paul Biya has all along been absent in the fight against the coronavirus. Other heads of states have made statements, have spoken to their citizens, but the President of the Republic is yet to do so. However, the measures that have been taken so far for the fight against the COVID-19 in the Republic of Cameroon have been taken according to the government officials, notably the Prime Minister, the Minister of Public Health, the Minister of Transport, the Minister of Trade, and all the others on the instructions of the President of the Republic, who has just created a fund for the fight against the COVID-19 in the Republic of Cameroon. Now we are moving on to something else to talk about the fight against the COVID-19, which is affecting transport, notably in the city of Douala, and drivers are urging the government to reduce the cost of fuel so that they can be able to manage with the instructions given by the Minister of Transport to stop the spread of COVID-19. Immaculate Fogwe reports.
Public transport in Cameroon, according to health experts, is highly vulnerable to disease outbreaks such as the global coronavirus pandemic. The confined spaces and limited ventilation of public transport vehicles could lead to infections amongst passengers. However, the government of Cameroon, in one of its 13 measures taken to curb the spread of the virus, has called on transporters to limit the number of their passengers in a bid to respect the rule of social distancing. While on a tour in some major roundabouts in the city of Douala, a great number of taxi drivers could be seen respecting the measure implemented by the government of Cameroon. We are respecting the measures in order to prevent ourselves from equally being infected. Things have become extremely difficult for us. We cannot increase transport fare because we understand the situation of Cameroonians. The government could help us by reducing the price of fuel. The government has to accompany us in this situation because it is difficult for us. We spend the whole day without being able to get 3,000 CFA francs. Interurban transport agencies are equally stepping up the fight to help curb the spread of the virus in their different traveling agencies. A daily routine of sanitizing their buses have been implemented. Water and soap has equally been made available for passengers. We are respecting the measures implemented by the government with regards to the transport sector. We do sanitize our buses daily. A bus which is meant to carry 70 persons is now carrying 50 persons. Drivers are calling on the government to see to it that the applieds are taken into consideration so as to enable them meet up with running costs.
In Ebola, in the south region of the Republic of Cameroon, the fight against the COVID-19, particularly the measures taken by the Minister of Transport, curbing the number of persons who are supposed to be transported on motorbikes, in taxis, in inter-urban and intra-urban transport buses, is having an adverse effect on business, and the drivers are calling on government to do something to mitigate the impact of the fight against COVID-19 on their activities. Otherwise, it's going to be very difficult for them, and they may be compelled to put an end to all transport activities in that part of the country. Details in the following report.
Over in the south region of Cameroon, the implementation of the COVID-19 preventive measures taken by the government of Cameroon has created animosity among travelers, owners of travel agencies, and individual commercial vehicle owners. Travel agency owners say their profit margin has been reduced as they are compelled to do just 5 trips a day. Transport cost between Ebolova and Yaoundé has been reduced from 2,300 francs CFE to 1,500 francs CFE by the senior divisional officer for the Villa division, who conditioned that as the contribution of owners of interurban transport agencies in Ebolova to the government of Cameroon's fight against COVID-19. Take a 30-seat seater bus, for example. When you reduce 15 places as demanded by the senior divisional officer, you will lose 45,000 francs CFE to and from Yaoundé. What will you be left with for fuel, for the driver, and to settle control? Travelers who fail to catch up with the few trips of travel agencies are compelled to pay between 3,000 to 5,000 francs CFE to individual commercial vehicle owners from Ebolova to Yaoundé. I had to travel to Yaoundé, but was told that trips have been limited to just 5 a day. We are just confused. Today we are asked to pay 4,000 francs. The next day we are demanded to pay 5,000 francs, and so on and so forth. Faced with the complex situation and unable to meet up their running costs, interurban travel agency owners in Ebolova say they have opted to shut down their activities. According to Takojo Cyril of the Villa Voyage, a meeting has been planned to explain to his workers the need for them to go on break. He has also forwarded necessary documents to the Labour Inspectorate to inform them of his decision to send his workers on break. Look at how travelers are exploited by individuals. They are made to pay 5,000 francs CFA from Ebolova to Yaoundé, but the senior divisional officer insists that we of the travel agency should collect just 1,500 francs for the same distance. We have decided to stop work. It is not profitable at all. To effectively implement the government's measures against COVID-19 in the transport sector in Ebolova, travel agency owners say the government should reduce fuel prices just to enable them meet running costs.
One person has died and 2 others have incurred minor injuries in a road accident that occurred earlier today in Cameroon's economic capital, Douala. The accident occurred at Entrée Bellavie Junction in the Douala 3 municipality. The accident occurred this afternoon, and a truck transporting cement, or rather sand, is reported to have lost control, and it bumped into a lady selling things by the roadside and a motorbike and its rider. The biker died on the spot, and the truck driver and the lady incurred minor injuries. And that's it for this edition of the news on Equinoxe Television. Thanks for staying with us.